Hi guys, this is Talin Pepper, doctor here at Dr. Pepper Physical Therapy. And I want to talk to you a little bit about a couple things. I get a lot of questions about, hey, I'm having a total knee in a few weeks, and what do I need to do to get ready for it? So I get a lot of questions like that. So what I want to do is go over a few things to do that. First thing I want to talk about is common suggestions for home preparation. So first, you want to do something about meal assistance. So there's a lot of groups, local church groups, friends, who you may ask to help provide meals or help around the house. So maybe a friend, spouse, caregiver, so to prepare some things. Maybe for the first 4 weeks would be good to look at providing those, because it's going to be a little bit before you can get out and get to the grocery store. Second, transportation. You're not going to be able to drive for the first 4, maybe up to 6 weeks. It just depends on how things are going and which leg that they do. So you're going to want to have transportation lined up for follow-up appointments to go see your physician. If you need to go to the grocery store, make short errands or trips, you'll have to have somebody take you, because you won't be able to drive in those first few weeks after surgery. Third, you're going to want to stock your pantry. You want to put some things in your pantry, like pre-made meals, snack items, toiletry items, those things like that, so that you don't have to rely more on transportation of going to the store, getting out too much in those first few weeks. Number 4, prepare your house. So if possible, you're going to want to be on one level. So if you have a 2-story house, you want to be sleeping and waking, doing things on the same level of your house. So you may set up a bedroom or something downstairs if you have an upstairs house, but mainly try to get on one floor, so you're not having to go up and down the stairs, because that's a difficult thing to do. Second, you want to check for tripping hazards, so move things around like cords, or if you have tight spaces or narrow areas, because you may be in a walker or you may be using an assistive device, so you're going to want to make sure that you don't have any tight spaces or things that you may potentially trip over. So check the house, make sure that there's not things like that. You may even kind of imagine like you're walking into the house with a walker or with a cane, probably a walker if you're first coming home. And just imagine you're doing that and kind of look around and see, hey, this might be a problem, like this rug or this walkway or this step. You want to kind of work on navigating that a little bit and make sure things are in a good place so it's not a big problem for when you first come home. Maybe installing small rails or grab bars in like the shower or toilet areas. If you need help with figuring some of those things out, I can definitely give some recommendations, or even if I need to make an evaluation, go out to your home to evaluate your space. That's something that we can definitely do, but you want to take a look at some of those things. Those could be very helpful. The next thing, maybe a modified toilet seat. Usually when you're getting up and down out of chairs, after that knee replacement, you're going to be using one leg to do it, and so it's kind of hard to do for a little while. So putting a raised toilet seat can help alleviate some of the stress that you're going to put on your knee when you're getting up and down off the toilet. Next, prepare your shower. You may want to put a small shower bench. There's lots of them on Amazon. They're not that expensive. A stool, something that you can get in there and sit, because you're not going to want to be standing in the shower, and you're also not going to be able to get up and down out of a tub. So you want to make sure that you have something to sit on, so you're not on a slippery surface navigating with one leg. Good seating. That's the next thing. A good comfy recliner chair with either an ottoman or get a good step stool with pillows or something to rest your leg on, because you want to have it in a nice comfortable position to either work on stretching or just getting in a comfortable position to elevate it and get some of that swelling out and ice it, which is the next thing we're going to talk about, is have a good cold pack. I have some great recommendations for cold packs on Amazon. They're fairly inexpensive. They're really good for keeping things nice and cold. So get those lined up in advance. Sometimes they'll send you home with a circulating cold pack. Those work pretty well. I find they don't get it as cold as we maybe like it to help to alleviate pain. So we can line you up with some of those things like that, and I can give you recommendations for those. Last is practice. You want to consider either getting a hold of a cane or a walker, either pre-purchasing them, or if you already have one, great. You want to start practicing with those devices ahead of time to make sure that you're proficient with them. I have a lot of people who have trouble when they first start trying to use a walker, so I want you to start trying to practice those things.